We've been talking this afternoon about the impact of breast cancer. If you do develop the disease, you want doctors to detect it as early as possible.
And that's why it's so important to stay on top of screenings like a mammogram. But that test can only see so much. So now there's new technology that's giving doctors an opportunity to screen patients in a way that was never before possible. And joining us today to tell us more is Dr. Andrew Venos with Peninsula Imaging in Salisbury. Thank you so much for joining us.
Thank you for having me.
Okay, so we've said it before, but it's worth saying again. Early detection is key, isn't it?
Yes, this is an example of preventive medicine, much like having your blood pressure controlled or quitting smoking. The goal is to detect an abnormality early so that it can be addressed before it has a chance to spread.
And something called 3D mammography is giving doctors, I guess, a clearer picture of what's going on with their patient. What is it?
Right, 3D mammography is a new technology. It is basically a mammogram, but instead of taking a few pictures, there are multiple pictures taken, and the computer then generates an image that we can look through, a slice at a time, if you will, almost like a CAT scan or an MRI, so that we can see all the depth throughout the breast tissue.
Now, how does this differ from a traditional mammogram?
The patients probably wouldn't notice much of a difference. The machine looks a little bulkier, and it does make an arc when it takes the images, but otherwise the woman will experience the same thing. There's still compression to hold it still so that there's no motion, but other than that, the patient would not notice a difference.
So something that I hear happens with a mammogram is something called a callback. Can you explain to me what that is?
Right. A callback is when the radiologist, after reading your screening mammogram, finds an abnormality that they think may be worrisome, but they're not certain. So we'll call the patient back, usually in a few days. The patient will return and we'll do special views, like a compression view, sometimes an ultrasound. This is somewhat aggravating for patients, and it's understandable because it creates a lot of anxiety. So the new device is supposed to decrease that rate of callbacks because we're taking more images up front and we're able to see more breast tissue. So in theory, the callback rate should be less.
Oh, so you're getting everything all at once. So
Yes.
Would you say that the 3D technology is better at detecting breast cancer?
Yeah, the studies performed so far say that the device is able to detect cancers earlier. At this point, roughly about 1 to 3 out of 1,000 patients that have a screening mammogram will detect a cancer. And this device should be able to increase that to about 4 to 5%, which doesn't sound like a lot, but it's a fairly significant increase.
So with the new 3D mammography, does that change how often somebody needs to be screened?
No, that has nothing to do with how often the patient should be screened. The guidelines are still the same. A woman after 40 years old should have a mammogram every year.
This is really exciting. It sounds like this 3D mammography is really an advancement in cancer detection, isn't it?
Absolutely. It is probably the single best advancement in the last 30 years.
Wow.
Doctor, thanks so much for joining us. And if you'd like to read more about Peninsula Imaging, about 3D mammography, go to WBOC.com and click on our picture at the top of the page. Well, one thing certainly difficult to spot, often until it's too late, fraudulent activity on your bank card. Coming up next, how some very sneaky criminals are stealing your card information with each and every swipe. How you can get in front of this crime and save your hard-earned money.
Plus, you may spot someone you know during today's Most Wanted Monday. See who made this week's lineup and how you can earn a few bucks with a simple phone call. Delmarva Life, we'll be right back.